Viewers Global Window han aji naithu by the park dahin ase aji health financing reform for cross state learning in Northeast region. It is organized Krishe Department of Health and Family Welfare, Government of Nagaland, in collaboration with the World Bank. It is a platform to share experience, disseminate key findings, and foster mutual learning on health financing reforms and universal health coverage across Northeast state. Ajilaga special guest ase T.R. Ziliang, Deputy Chief Minister of Nagaland and Minister of Planning and Transformation and National Highway. Irudu duitin kurule ase, that is date 7 and 8 of October. Ahibi tulaga opore amikhan details precise abo.
Honor and a privilege to have in our presence a galaxy of distinguished guests, officials, developmental partners and participants to the inaugural function of health financing reform for cross-state learning in Northeast region. This forum offers a valuable opportunity to come together, exchange experience, and reflect on shared challenges and explore innovative strategies aimed at strengthening health financing and achieving better health outcomes across the states of Northeast. Now I call upon our Commissioner and Secretary, Health and Family Welfare, Sri Anup Kimchi, IS, to say the welcome address.
It's my proud privilege to welcome you all to this inaugural program of Health Financing Forum for Cross-State Learning in Northeastern Region. Today marks a significant milestone not only for the Nagaland Health Project, but also for our journey of shared commitment to improve health outcomes, strengthening health system, and building the resilient communities. The gathering is an opportunity to reflect critically and collaboratively on lessons learned, innovations piloted, and challenges encountered. I'm sure the insights will help in shaping stronger, effective health policies and practice in future. The project has led to improved understanding of state-level challenges in the financial management and RBF implementation, with strategies for scaling up reforms towards universal health coverage. As we go through the sessions, I encourage everyone to engage deeply in the discussions and sharing of experiences. Let it be a true forum for not just what worked, but how we need to improve. I'm sure a lot of learning coming our way. I once again warmly welcome you all and thank you for being part of this important dialogue. Thank you.
Good morning, everyone. It's a privilege for the World Bank to be here today in Nagaland. We are very proud to support the government of Nagaland in hosting the Health Financing Forum for Cross-State Learning in the Northeast. So over the past decade, as some of you might know, we have worked very closely with the government of Nagaland, but as well other northeastern states to advance several health reforms, which were actually mentioned before. So this region, as you might know, has faced several challenges, being difficult terrain, extreme weather events, and historically as well, low health spending. So despite these hurdles, despite all these many challenges, the Northeast has actually showed very strong resilience, which again was mentioned before, and a very strong community spirit. And all of these have actually been key drivers of those very successful health reforms. So we'll also highlight some key findings of some of the recent analytical work that many of you here have been leading. For instance, several analytical work around universal health insurance in Mizoram, in Nagaland. Some other work around implementation research on RDF in Nagaland, in Meghalaya, in Mizoram, and in Assam. We'll go through as well some other studies you have done in the area of governance, public financial management, in health, like in Nagaland in particular. And as well, we'll look into some work which has been done on climate health and financing. So again, a very warm welcome to this workshop, full of promising practices and bold ideas. We hope you leave inspired with practical insights that you can take back to your own state and hopefully apply to your state, again, to save lives. So one very last thing, we are very, very grateful for the strong participation from Northeast states, but as well from international colleagues. I know it took a lot of effort to have everyone here in this room. So again, it's a true privilege to support the government of Nagaland hosting such event with a diverse group, and I hope we can really make the most of it. Thank you.
As soon as I heard about this interfacing meet organized by Health and Family Welfare Department, I accepted to be the special guest outrightly, without any hesitation. Why? Because among all the departments in the country or all over the world, the most important department is health and family welfare. Healthcare is most important. Education is for certain group of age, school education, college, university, for certain age of group. Sports, only for certain age of group, not for all ages. But healthcare is from oldest to the youngest. It covers every population. So we take it that this department is the most important department among all the functionaries, the department. So I think we should take it this important because it is for every section of people. Even the oldest man among the society, he don't want to die early till he breathes last, including disabled people, handicapped people. They don't want to die. So today, health conscious become very important for all over the world. So I take it is a very important interaction. It's a privilege to join you in Dimapur, now Chumukadima, for this important gathering on health financing reform for cross-state learning in the Northeast region. Your presence reflects a shared commitment to strengthen the foundation of health systems across the region, systems that are equitable, efficient, and resilient. The Northeast region, with its rich cultural and ecological diversity, is home to over 52 million people. Yet, despite its promise and potential, the region continue to face structural challenges that constrain growth and equitable development. The predominance of rural livelihood, difficult terrain, and limited connectivity make service delivery uniquely complex. These challenges are compounded by climate change, a reality that is already altering disease patterns, food systems, and disaster risks across the region. As we convene over the next few days through panel discussion, technical sessions, and field visits, I hope we use this opportunity to identify what works best in different contexts across the region, to strengthen collaboration between health, finance, and planning department, and chart a shared roadmap for scaling up reforms that move us closer to universal health coverage. I hope this workshop is not the end of a project cycle. It is the beginning of a new phase of cooperation, one where data, evidence, and dialogue drive policy. The road to universal health coverage in the Northeast may be long, but it is within reach if we continue to innovate, learn from one another, and invest in systems that place people, especially the most vulnerable, at the center. I commend the Department of Health and Family Welfare, Nagaland, the World Bank, and all participating states for making this interface possible. Let this forum be remembered as a moment when the Northeast came together, not just to discuss reforms, but to build a shared vision and a healthier, more resilient future. I wish all the participants to interact with each other, and the outcome will be successful for the region. Thank you, and God bless you.
Through federal engagements and state engagements, the World Bank has worked in all states in the northeastern region. Health in particular, we have worked in 4 states so far: in Nagaland, Assam, Mizoram, and Meghalaya. All of these 4 projects are known to be very innovative, with our client counterparts having open-mindedness for trying new things. Trying new things with cutting-edge technology. We will learn at this forum today and tomorrow what those lessons are, and we would have a lot of debate on those. We are in extraordinary times. In India, we are all facing huge competing needs and demands for human capital development and economic growth for Viksit Bharat. This in the context of demographic and epidemiological transitions, and in the midst of increasing climate change-induced calamities. At the same time, governments around the world are facing declining development aid, including or particularly for health. It is opportune time to take stock, learn from each other's experiences, and have frank conversations about what has worked and what, importantly, how we can do things better to use the valuable resources we have more efficiently and effectively towards universal healthcare. We from the World Bank have brought together experts with the best analytical minds and knowledge in health financing, public financial management, and economists experienced not just in India, but globally. We thank the government of Nagaland for bringing together the governments of Tripura, Mizoram, Assam, Meghalaya, Sikkim, and Manipur. There is a lot of academic, analytical, and global knowledge embodied in these experts today. There's a lot of local knowledge and experience embodied in each of the government representatives. By bringing these together, we hope new ideas and initiatives would breed. Please share your ideas, your challenges that you face, big and small, and ask a lot of questions. I look forward to the rich discussions during these 2 days. But also, please don't be shy about asking people's contact information so that, of any of these experts today, so that you can reach out to them later and pick their brains. So, thank you very much, and with this, let's start.
Health Financing Forum. What do you think about it, and what do you think it entails for the Naga people?
I strongly feel that this forum will take the people forward, because Northeast, we alone could not coordinate with each other, but World Bank people chipping in, and also the Gujarat government coming into this group. I think it will take us a long way, and it will help the people of the entire Northeast, because through interaction we learn from each other. So I feel that this forum will go a long way.
So viewers something han mi dikhi paise aji laga program laga upore yete around 100 manu nishna ahine participate korese khali ami khan North East laga no hoigine Uzbekistan, Belgium, Japan naholbi Austria, Australia aro Belgium khan itu khan babi ahine shamil korese khali ite laga state government khan laga medical department khan no hoini bi government officials khan bi ide program de ahine shamil korese itu du din kane ase aji aro kali date 7 and 8 of October. It is a special guest as a TR Zeleng. It is a new project. It's the beginning of new phase of cooperation where data, evidence and dialogue drive policy ko ini bi janai aro tai bra khushi pabi janai di ase to the Department of Health and Family Welfare Government of Nagaland aro to do etwiklan hoine World Bank khan gibi aro do different participants from different states of Northeast. Iniga ami khan laga state te anine inega program banawole possible kuri dia gane koine ta khushi pabi janai di ase itia kane manase. For more news and update, keep watching Global Window. This is your reporter Yaungamla with my camera person Anungai Jamir reporting from Naithu Resort, Chumugirima.